so forth, do great things for your mind, your body, and your American spirit. We're going to read a quick, brief history of health policy in the United States. We will go into direct details of specific legislation at a later time. This is the National Library of Medicine of the National Institute of Health. Brief history of health policy in the United States. Catherine Smith. Introduction. Trying to summarize the history of health policy in the United States is a massive undertaking. What should be included? What should be ignored? How should events be separated? Fortunately, the Kaiser Family Foundation, note, they had a direct impact on the 1970s legislation on health insurance that we currently have today, has already done an excellent job breaking down 1,000 years of U.S. health care. 1900s, figure 1, 1930s, 1940s, 50s, all the way up to 2000s. U.S. health history accomplishments. 1900-1929, health policy and reform in the United States began in 1912, when Teddy Roosevelt and the Progressive Party endorsed social insurance as part of their platform. This included health insurance. Not to be outdone, in that same year, the National Convention of Insurance Commissioners developed its first model of state law to regulate health insurance. A few years later, in 1915, the American Association for Labor Legislation drafted a bill to require health insurance. The United States entered World War I soon after that, and the bill was not enacted. In 1921, the Shepard-Towner Act was passed, providing matching funds for states for prenatal and child health centers. This act would expire in 1929 without being reauthorized. In 1927, the Committee on Cost of Medicare was formed to study the economics of medical care. The group including physicians, public health specialists, and others. The recommendation report was published in 1932, and the majority endorsed the ideas of medical group practice and voluntary health insurance. By 1929, Baylor Hospital had introduced a prepaid hospital insurance plan, considered the forerunner of the future Blue Cross plans. 1930 to 1939. In 1930, the United States was in the midst of the Great Depression. 29 to 39, and social policies to secure employment, retirement, and medical care were needed. President Franklin D. Roosevelt appointed a Committee on Economic Services Security to address these issues, but a national health reform did not advance. The Social Security Act was passed in 1935, which included grants for maternal and child health, which restored many of the programs established under the Shepard-Towner Act. We will read through that later. It also expanded the role of children's bureaus to include child welfare services. In 1935 and 1936, the National Health Surveys was conducted by the U.S. Public Health Service to assess the nation's health, including underlying social and economic factors that affect health. This survey would go on to become the National Health Interview Survey. In 1938, the National Health Conference was convened in Washington, D.C. Recommendations from that conference were incorporated to the National Health Bill, which died in committee in 1939. In that same year, the first Blue Shield plans were organized to cover the cost of physician care. 1940-1949, the 1943 legislation was introduced to operate the health insurance as policy, Social Security. The Wagner-Murray-Dingell bill, we'll go over that later, included provisions for universal comprehensive health insurance and changes to Social Security to move it forward, a lifelong social insurance. It did not pass. 1944, Roosevelt included the right to adequate medical care and the opportunity to achieve and enjoy good health in this iconic bill, a right State of the United Union address. Also in 1944, the Social Security Board called for required national health insurance as part of the Social Security system. Sounds familiar. President Harry S. Truman revived the idea national health program just after the end of World War II. The Wagner-Murray-Dingell bill was reintroduced into Congress, along with new Taft-Smith-Ball bill, authorizing grants of state and medical care for the poor. Neither bill was passed, and both would be reintroduced in 1947. 1946, the Hill-Burton Act was passed. The bill funded construction of hospitals and prohibited discrimination of medical services on the basis of race, religion, and national origin. It required hospitals to provide reasonable volume of charitable, allowed separate but equal facilities. In 1984, the National Health Assembly was convened by a federal security agency, the final report voluntary health insurance. But it also stated universal coverage. That same year, the American Medical Association would launch a national campaign against national health insurance.